Hello, everyone, and welcome back to the CLSR. And I'm your host, the counselor. Today, we're going to be talking about how we support our friends and family who may be going through some situations dealing with loved ones who've passed on, or they're maybe grieving in their own situation. I'm sure we all know some people who are grieving or having some complications with loss, or having some complications in their personal situation, whether it's loss of job. However, it's important for us to be able to support people who are going through this process. And how do we do that? How do we support people who are dealing with some sort of loss, right? So it can be difficult to know what to do or say. We want to support them as much as we can, but it can be a struggle for many of us because we don't know how to properly respond. Could be some intense, painful emotions, which could even include depression, anger, and guilt, and some profound sadness. And these people will feel isolated and alone in their grief. This intense pain is a difficult emotion and makes people who want to give support uncomfortable because they're not sure how they can give support. And you may be one of those people who might feel that you want to support a family member or a friend, but you just don't know how to go about doing it. Because a lot of times we're afraid. We want to help, but we're afraid to help because we don't know what to do. And, we might be afraid of intruding or saying the wrong thing or making your loved one feel even worse at such a difficult time, or even a sense of rejection. Or maybe you think there's little you can do to make the situation improve, which is very understandable. You don't want to let discomfort prevent you from reaching out to, to supporting somebody who is grieving, especially now, especially during this pandemic when a lot of families are going through a lot of loss and they need your love and support. You know, you don't have to have all the answers, and you might make some mistakes when trying to support them. However, just your attempts, it might not seem like it, but this could be something that is well received over the long run. The most important thing you can do for a grieving person is just try to be a supportive person. Make sure they're there, you're present, you show you care, and that you can help them cope with this pain, and help them get through this in some sort of way. Just being a support, like a foundation for them, someone that they can lean on, depend on. So, how to help these loved ones who are grieving. You just don't let fears about saying or doing the wrong thing stop you from reaching out. And let your grieving loved one know that you're there to listen. Not there to tell them how to get over it, tell them what they think they should do, what steps they could do. No, just be a good listener. And I mean a listener, not a talker. They don't really want to have their minds filled with a lot of chatter. They want somebody who's just going to hear everything that they're saying. And even if you're just nodding and giving that positive, communication vibe where you're letting them know that you're actually listening to them. Not really saying too much, but, keeping it minimal with the verbal. And let them understand that everyone grieves differently and for different lengths of time. They have to understand that. And you have to understand that as a person. You can't start forcing your agenda on those people, trying to tell them what's good for them and how long you think it will be. So you can offer to help in practical ways. And if you are going to places like funerals, maintain your support even after the funeral. A lot of people, when they have funerals, they'll see the family members and or friends, and they'll go to the funeral, but then after that, they just disappear. And that could be devastating for a lot of people who might need your support, especially after that time. That's when they could be at their most vulnerable moment, where they're sitting there alone, maybe thinking over things or getting themselves into a funk or a depression because, yes, they just had the funeral. And you will hear people say, well, you know what, I'd like to be alone. Okay, that's fine. But you check on them every periodically, every once in a while. But there are people who will say, I just need some alone time. But a lot of people, however, do not need it. They need somebody who they can talk to or reflect on and get through it. So that could be you. You could be that individual that takes on that role. But you have to understand the grieving process. For you to take on that role, there are certain things the counselor's going to have to alert you to that will help you be that good support person. Because the better you understand grief and how it is working in the healing process, the better equipped you'll be to help a bereaved friend or someone you love. See, and I tell all of the people that I talk to the same thing. There's no right or wrong way to grieve. It does not always happen in a certain pecking order. Like, it's not really predictable in its stages. It can be an up and down situation where it's like unpredictable. You're going to have your highs and your lows, and you're going to have your setbacks, and people are going to deal with it differently. You got to tell your loved ones what they should be feeling, is an open minded to understanding that this is a process that will take time. But you also have to be aware of the extreme emotions that the people will be going through, like those feelings of anger, desperation, fear, and guilt, which are very common. A grieving person may yell to the heavens, you know, obsess about the death, lash out at loved ones, or cry for hours on end. And this will scare many of you because you will say, wow, this person is really having a breakdown, or this person's going through it. As much as I understand it, I'm a little scared, I'm a little confused because I don't know how long this could last. This has been going on for hours, and I don't know if I'm equipped to handle it. Well, that's where you're going to have to really take some time to just step back and be the supportive person and not really make any movements that may threaten a situation, trying to get the person together, trying to remedy the situation out of fear rather than lack of understanding. Your loved one needs reassurance that what they feel is normal. So you don't want to judge them or take their grief reactions too personally. That's the last thing you want to do. And we talked about time limits. You know, it can vary, but it can be from like almost a year and a half to 2 years for some people. It could be longer. Depends how those people are reacting, how they're dealing, who they're in contact with. Do are they back on their feet? Or are they still struggling in isolation, in their depression, or they working through it? Are they getting support? So these are things you have to look. You don't want to pressure the loved ones, to move on or make them feel they've been grieving too long. This can actually slow down the whole process of improving and healing and getting better. So you don't want to push your agenda on anyone. Make sure you're clear with that. It can take some serious time. And even people who go through grieving too quick might come back and bite them later, right? It's just important that we understand that before we start walking into a situation that we're unfamiliar with. Oh, we just want to help, but we don't know how to help. Sometimes you can make it worse. And that's often what we feel, that we're making the situation a lot worse than what it is. So what are some of the things you could say to people who are going through this grieving process? Well, many of us worry about what to say to the grieving people, and I say, don't worry about that. Be more of a listener. Well meaning people avoid talking about the death or change the subject when the deceased person is mentioned, or knowing there's nothing that they could say to make it better. So they try to avoid the grieving person altogether. Well, just try to be a good listener. You need to feel that that person and you are not on the same level. They're going through something so traumatic that's changed their life that you might not be able to fully understand. So you don't want to start saying, "Oh, I know what you're feeling." Those are statements you just don't really want to use on that person, because they're going to carry on. And you have to understand that if this is something that you're really trying to be a supportive person, you know, watch what you say. One day this person's going to be reactive, the other day they may be calm. It's going to change from one day to the next. So one day they may want to cry on your shoulder, on another day they might want to vent or sit in silence or share memories. Just by being present and listening and compassionate, you could really help someone who's grieving. That is one of the most important. So, how to talk and listen to someone who's grieving? Well, you should never try to force someone to open up. It's important to let your grieving friend or loved one know that you are there to listen. Talk candidly about the person who passed away. Don't steer away from the subject, especially if the name comes up. And when it seems appropriate, ask sensitive questions without being nosy, right? And invite the grieving person to openly express their feelings. See, you are really coming from that caring perspective. And ask them too. Don't be afraid to ask them. Do you feel like discussing this subject? You are giving them permission. You're letting them know, your loved one know, that you're available to listen. So it's okay to ask, hey, do you want to talk about this? Is it okay that we talk about this? You can do that. Do some check-in and ask some questions, right? But make sure that you can also acknowledge the situation. You can say something like, I heard that your loved one died, and died is a trigger word for many people. But especially for the grieving person, that word died might be a little harsh. You might, well, has passed on, or, you know, is no longer with you. But died could be a trigger word for somebody. Just expressing your concern. Watch for some of the trigger words. Let the bereaved talk about how their loved one died, if they're going to talk about it. Don't you be the one to bring that up. Let them discuss it on what has happened, if they do. Because people who are grieving, they may need to tell you their story, their side of events, how they perceive things. And sometimes it could be very detailed. So patience above all is so, so very important. And you'll find that those people will, you're going to have super patience, because you're going to find that those people will be repeating those stories over and over again. Not the same day, but throughout the week. They'll just keep rehashing, bringing it up, and you might be exhausted. You might not even want to hear anything about it. But that's what being a good listener and a compassionate person is all about. Being able to withstand some of that, repetition. The story that's going to come, expect that it's going to happen. They got to get it through their system. Think of it like they're going to play it over and over until it wears out. And that's where you are in the process of just being that good support person. And accept their feelings. Let them know that it's okay to cry. It's okay to hang your head. It's okay to scream. It's okay to, just feel sad. It's a highly emotional experience. So they need to feel free to open up themselves, no matter how irrational. And we cannot be judging these people. We cannot criticize, and you don't want to argue with them. Arguing is so easy to do. I think arguing can be avoided in many situations if we learn how to pay attention to other people's feelings, and if we're more empathetic. But allow them to express their true feelings. And make sure that you are genuine in your communication. Make sure that you are saying what you really mean, and expressing the truth. Don't go above and beyond, because it will look fake. Don't try to minimize their loss or provide simplistic solutions or offer unsolicited advice. It's better to just listen. If you're not sure what to say, Don't say anything. Just say, hey, I'm here for you. If you need to talk, I'm here. I'm here for you. If you need to talk to me, I'm right here. Okay? And give them some communication, whether it's a text, a telephone number. Just let them know that you are there for them. Be willing to sit in silence when necessary. Don't press, especially if the person doesn't feel like talking. Understand their processing. Use your eye contact, squeeze a hand, reassuring hug. Just offer your support and ask them what you can do for them. Be specific. Any task? Could I cook you something? Can I get somebody here for you? Is there anything that I could do, within reason? And that person might just need a person to lean on, someone that they can cry with, someone who could just be there for them. But then we also have to be very careful, because there are things that people say, and this is why they're afraid, because some of their past experiences, they have done things with people who were hurting or dealing with loss and grief that has created a certain fear in them and anxiety in them. And that's why some past experience has affected them to the point where now they just try to avoid it in all situations. Anybody who's grieving, funerals, whatever, people stay away from it because they've tried to do something before to support, and they felt it backfired. They did not understand the process of grieving and loss. So, there are certain things you should not, absolutely, you should not be saying to somebody who's grieving or who's just had some loss. You don't want to be saying like it's part of God's plan. This can make people very angry and often respond, and then they start going in and focusing on what you just said. What do you mean the plan? Nobody said anything about a plan. This wasn't planned. This just happened. And next thing you know, it gets out of control. So you don't want to use any reference to how this is God's doing in that. Not in those moments. And don't say, look at what you have to be thankful for. They know what they have to be thankful for, right? They're very aware, but not at this moment. It's not relevant to them. It's not important. These people aren't going to care that they should be thankful, because we use that. Thankful, especially with something so traumatic like a loss, it's hard to think of things you could be thankful for. And one comment that I always hear is, they're in a better place right now. The people who are bereaving, the bereaved, they might not understand or believe this. So you have to keep those comments to yourself, those beliefs to yourself, unless you're asked. But they're in a better place, or he's in a better place, or she's in a better place. Like, put that into perspective. First of all, not everybody is really thinking on that level, a better place. How could it be a better place? Because they might be thinking, well, how are they in a better place? They're not here with me, the one that loves them. So you don't want to say that. You don't want to even make those comments. They're in a better place right now. Or what about, this is behind you now, it's time to get on with your life? Well, as we mentioned earlier, people who are grieving, dealing with the loss, this is something that's personal, and it's in an individual. Sometimes the bereaved are resistant to getting on with, because they feel this means forgetting that one, leaving them behind. They almost look at it as a disrespect. Well, I'm just moving on, and now all that love and care that I have for the person is just thrown away. And it's considered to be moving on as easier, which it really is said with a grain of, just move on past this. Rather, to them, it's much easier said than done. Grief has a mind of its own and works at its own pace. And so don't say, it's behind you, or let's move on with your life. These are statements you do not want to say or encourage in any sort of way. And statements that begin with you should or you will, they're too directive. Instead, you could begin your comments with, have you thought about, or you might try, but if that's, you should get yourself together and forget about this and move on, or you'll be better. You don't worry, you'll be better in a week. You won't even worry about it. Oh, those are detrimental comments. That could get someone's back up, really get them to a point where they're oppositional and defiant. But just by understanding certain things you should not say, that's going to help you in your approach, especially when you're trying to support someone. And just make sure you're really trying to offer practical assistance, because it's difficult for many grieving people to ask for assistance or help, you know, without feeling guilty about receiving so much attention. You know, they don't want to be burdens to people. You know, they could be simply too depressed to actually lend that hand out. You know what I mean? They might not want to put that hand out for that support. You know, they might not have the energy or the motivation, any inclination when they need something. So instead of saying anything other than let me know if there's anything I could do, be specific. You know, I'm going to this store or whatever, and can I get you anything? So you help them that. You don't just keep forcing that same statement. Is there anything I could do? Because that's a very general statement, right? That's a very general. Is there anything? Because most of them say no. So you start doing things that are specific that they can latch on to. That makes it easier for them to ask for help. Like, I'm going to be picking something on the way back. I'm going to grab you something. And it could be, okay, that's great, thank you. More receptive to your suggestions, right? That is where you want them to be. Not always answering these questions, these generalities of how you can help. Make it specific. Understand a little bit of what they're going to need and try and incorporate that in your assistance. If you're able to try to be consistent in your offers of assistance, that's wonderful. Because that person who's grieving, they will know that you'll be there for as long as it takes. And they'll look forward to that attention that you're giving them. And they know that, listen, that is one thing I can count on, somebody being there for me, and I'm not going to be, having to ask them all the time. I know they're there, and that's comforting. There's just so many ways that you can, like, some people are stuck on how they help. Well, how can I practically help this grieving person? Well, as I mentioned, you can drop off a pasta dish or something, some meal. You can go shopping for their medication or some groceries or run a couple errands. You can assist with maybe some funeral arrangements. That is a very big help. That takes a lot of work, and some people aren't in the right frame of mind to be doing that planning, or they're lost. They've never done it before. So they need somebody to be on their side. If they don't have family, maybe a good friend will help them. But helping with funeral, those are big things that will make that person at least function and go through it, knowing that they have somebody there that can, balance when they're trying to take care of their business to get this funeral done or worked over with all the supports in place, which can be overwhelming to somebody who's going through a lot of grief, right? You might even have to stay, depending on a friend or a family member, you might even have to stay in their home to make some phone calls, to call some family members or some guests, so just to reach out for them, to let them know maybe they were so down that they couldn't talk to anybody. And then you're just being that person, that supportive person that's going to help them make some calls. Give out the bad news if you have to, with their permission. Help with their bills, help them organized. They might have been in a shell for a week or so and they need to get back to reality. Maybe help them with their work, your laundry, the cooking and cleaning around the house. If they have children, find someone or help them support the children. Find if there's programs or something that you could do to work with the people so that they don't lose everything, sight of everything, because it can easily happen. You got children and a loved one dies, a partner or something, and it just all goes to crap. So getting someone to even help with the children and support that, making sure someone's picking them up for school if necessary, or they have the necessities to go to school. Or if you need to drive the loved ones to and from, because the one thing you don't want to do is have somebody who's going through the grief and the loss feel getting into that depression behind the wheel too much, and they have children. So offer to, hey, I'm going to pick them up and drop them off, or find ways just to get them through their hump. Who knows how long it's going to take, but that could be something you could do to help. You could look after their animals, their pets. And if they have group meetings, you can go with them to some of their group meetings. And sometimes people want to get out of their house and go for a walk around the block. You can accompany for them with them, sorry, on walks. And it doesn't mean you have to talk. They don't have to say anything. Sometimes they just get out there and take it. You know, take them to some event like a movie, a theater. Just make sure you're aware of the content of the movie, that it's not going to trigger them in any sort of way. If they want to go to it, accompany them. Don't make it your suggestion to be pushing in places they don't want to go. This is about them. It's not about you. And try to share your creativity. And if you want to play some games, if you're into art, museums, anything that's creative, try to share some enjoyable activities with the person. That's how you can support them. There's so many ways that you can support people, especially when they're going through their grief, that these are just a few of the examples that you could do. But one thing is important, which is essential, is ongoing support. Because we talked about it could last from a year and a half to 2 years. Sometimes it doesn't last that long, but sometimes it could. And when you get in, make sure you're making that commitment to understand that that person might need you. Not just every day standing on guard. No, but periodically they might need to just have you as a support person. It could get to the extreme where they need somebody right away, every day, for a certain period of time. Well, if you understand that's a role that you can play and you can commit to that, do that. One thing you don't want to do is you don't want to start making commitments that you can't keep. You want to be reliable, not unreliable. So you don't want to start telling them things that you can't live up to, because that's not going to help the situation and help them at all. So if you're going to continue your support and provide that ongoing support for that individual, make sure that you're willing to commit to stay in touch with that person. Just periodically doing those, dropping by and checking in. Maybe a little text here, email here. You know, Especially once this harsh times are done, the funeral planning is done, and they're going through that post phase where they're got all the major things taken care of with that incident, and now their mind is going to start going into a state of thoughts, and they're going to be starting to think heavy, especially when they don't have something to do. They're going to start really processing a lot. So that ongoing support is going to be crucial. It really is. It's going to be more valuable than ever. So just make sure that you don't want to make assumptions based on outward appearances, right? Because that person is going to be hard to read. It might look fine from the outside, the exterior, while inside they could be suffering. So you don't want to be, or try to avoid saying things like, "Oh, you're such a strong person. You are so strong," or "you look so good today." That puts pressure on people to keep up whatever peer pressure does, the appearances. You don't want to have people hide their feelings. You want to push them into something that they're not really feeling. That you got to look good, or you got to appear strong. No, they don't want that extra baggage on their plate. That's the last thing that they need. They don't need that, to be feeling that pressure, that peer pressure. Stop that if you get into that. You don't want to. You think you're doing them a favor by making these comments, but really you're not. You got to commit to this ongoing support and understanding that these people here need you as a support, not as a judgment, or not to be placing any extra pressure on them. And you also might have to come to the realization that this pain, that they're going through when they're grieving, it might not fully ever really heal. So when you go into committing to supporting someone, try to understand your level of commitment that you can give. And if you can't give it just all to yourself, then maybe you could split it with somebody or have somebody to work with you or a couple friends that say, look, I'm doing this to support this person. Could you help me with this? Because this could be a long time and this person's really going to need us to support them through this. So understand your level of commitment and things that you can't do, you have to be clear from. You don't want to start backing up. So make sure that you can commit a certain amount of your time and you're wholeheartedly doing that, you know, with the understanding that this person, might not get over this forever. It might not be as extreme, but a loved one passing on, for example, could be something that, they're gone. So this person's going to have something inside them that's always going to be hurting. They might have learned to accept the loss, but the pain is still, you know, in them, and it's affecting them, and it's causing some sadness, which might not ever completely go away, even though they've accepted the loss. They still have this lingering pain inside them that could be going on for until the day they're gone. However, it's not going to be as intensive as it would be initially when they went through this ordeal. So also keep in mind that if you are going to get into the long-term support, that you start thinking about those special days that may come up, whether it's the deceased birthday or anniversary. Try to make yourself a little bit available for those days, because those are the days where uh, it could really get to them. It could sink in, and they might need somebody to talk to or be around, maybe just to keep their mind off it, take them out and do something with them. Even if you take them out to a restaurant or do something, and let them be the conversationalist when it comes to dealing with that one who passed on. You don't want to initiate too. You just want to be there, especially knowing those dates and understanding that the check in and the commitment that you have given is something that they're depending on, and it's something that keeps them floating. Because one of the hardest things to do is find out where people are when they're going through this grieving process. It's very, very common for people to feel disconnected from others and depressed. And they sometimes will feel like they're going crazy, and these symptoms can be hard to detect. However, they're not always hard to detect. There are times where you can really see this person going, but it could be a serious problem. And a lot of things could be held inside of them. They can get to a clinical depression, right? Where it's so deep that it becomes ingrained in them, where they just shut down and they're not really functioning on any level. So you have to watch for the signs. And um, what are some of the signs that a person could be getting into this real depression? Real depression. You want to try to work with them as much as you can, but what are some of the signs? Especially after the initial grieving period. What are some of the signs? It's usually when it's been at least a couple months past the death or the loss that you start to see things or hear things. And some of those may include um, excessive bitterness, frustration, aggression, anger, and guilt that person may be displaying. They also could be one of those ones that are really focused on the death. All they talk about is death all the time. And, and talk about their lives, and they relate it to the ones who's lost. And they say they wish they were dead because they want to be with the person. They just focus on death a lot. And those people that focus on death a lot, it's just one of the symptoms that they're getting into a depression. And it also, if you see that they're having some difficulty functioning in their daily lives, a lot of things that you normally see them doing, they're not really doing those anymore. Not on a level where they're, you know, you see a balance in their life. You're starting to see that they're letting a lot of things go. They're not meeting their obligations. So they're just having difficulty getting up in the morning, getting themselves dressed, maybe taking care of the kids. Maybe the kids are taking on some of the responsibilities and it's a lot for the kids, but you see that they're still grieving a lot. And there's people who also they don't take care of their bodies, their hygiene, their health. So they let that slip. They stop taking showers and baths, and cleaning themselves. So they just don't. They're not motivated. There's no um, no feeling at all of just cleansing. They're just wallowing deep in it. So they're neglecting their health, their personal hygiene by not taking care of themselves. And there are other people who will um, end up going drinking. They'll take that drink. They'll go right heavy into the drug abuse or the alcohol, and you'll see it taking control of them and how it impacts their life. And you'll feel that there's really not much you can do, but do your best to support them. You can't change their whole life for them, but you do see that this is one of the symptoms or signs, rather, that they're really hitting into this level of depression where they're just drinking all the time. And it's become their favorite pastime. And then you'll see that there are people who will have the inability to enjoy life. They'll just, everything will seem negative to them. The words that come out of their mouths, the way they react, the way they're responding to people who they don't even know, or some of the requests that they're making of people could be a little excessive. So these people they're not enjoying life. They just given up. It's a give up state. And there are the severe though. There are the severe, and those people have hallucinations. And they start having hallucinations of many different things. Could have been the old relationship. Could be they think they're seeing somebody when they're really not seeing them. That is deep. That's very, very deep, and it needs some real attention. And by no means am I telling you that you're going to be able to deal with that. You won't really be able to deal with it. You'll be able to have to get them some support. You can't talk somebody out of hallucinations. They're going to have to try to get some professional help, some things. But if they're telling you these things, you can't dismiss them. You can't say, hey, you know what? Don't worry, you're going to get over it. It's a very common statement. Don't worry about it. You're just seeing it because you find out, because there are things behind those feelings and thoughts and visions that they're getting that they have to figure out. And of course, there'll be people who are grieving that will withdraw from others. Doesn't matter how close you try to get, they just withdraw from people and they don't want to be bothered. And that's when you feel as helpless as you can be. However, you do understand what they're going through, why they do withdraw. And many people will try to help, and there will be others that will say, I can only do so much. I can't change their life for them. I can only support them. And if they don't want my help now, there's nothing much I can do. What I suggest you do is, if let's say you are one of the main support people of this individual and you're used to being there for them and they don't even want your help, you're going to have to let some other people know what's going on, whether it's in their family directly or a professional. Just let somebody know that you're very, very concerned about them because of this thing, right? And you'll get those individuals who are grieving who have constant feelings of hopelessness, which is common, just a whole sense of despair and just no will to live. And a lot of people don't want to talk like that, but it's just the way they feel. They just don't feel, what's it all about? It's too deep for them. So they have a real sense of hopelessness and despair. And of course, you will get the talking about the dying or the suicide, which scares the mess out of a lot of people. Those are comments that it's alarm bells for a lot of individuals. I can't say enough that People will say it all the time. They will. They'll say it, and when they're in those desperate states, and people who are trying to help won't know what to do with that. They won't know how to approach it, where who they're going to talk to about it, or how are they going to approach that person, because it might not be good enough to go, oh, you don't want to die, come on, you got so much to live for. It's a lot more deep than that. There's a lot going on. So that's why I'm strongly recommending that, when the person starts talking that way, you be that person there for them for sure. However, let them get to a point where they're getting some help to process some of those thoughts. And, because it is a common comment out there. It's a scary comment, but it's a comment out there that people will say over, and most people don't do it, but we don't know what they will do. So you don't take that lightly. You let everyone know that you can support them, you know, but they have to come together with you to work with that person because they're at that level of talking about dying and suicide. But you have to understand that's part of the conversation, not to get spooked out by it, but to be more supportive, you know. Children are some of the most vulnerable. And when we're trying to deal with young people who are trying to develop, especially very young children, they feel this pain of bereavement. You know, they usually learn how to express their feelings by what they see us going through, or how we're modeling, or how we're dealing. So they're looking at the adults around them. So if they do have a loss from a family member, a parent, whether it's a sibling, they need support and stability, and they need some honesty. I know a lot of you have heard people tell them, oh, some fake story about death. They don't need that. They don't need stories. They need some honesty and some reassurance. They need to feel that they are safe. And that's the one thing you want to provide, especially to young people. You want to let them know that they're safe, and you can support them through the grieving process by demonstrating that it's okay to be sad, and that you're going to work with them and be with them through the way and help them as much as you can, so they have a voice and that they're going to be heard. Answer questions truthfully. Use simple, honest, concrete terms when explaining to children, especially young children, because they're going to get the feeling of blame themselves. They're going to understand that something serious has happened, but they won't understand how to deal with it in many different ways. So they're going to blame themselves. They won't know where to put the blame. They know something's happened, and they feel that, they might have something to do with it. So that you telling them the truth and letting them see that it has nothing to do with them. It's not their fault. It has happened. And you're going to work through it with them. But you want to take that weight off their shoulders by letting them know that, they're being supported and they can talk about, but they cannot be blaming themselves. Because real young children, they just don't know what to do with these strong emotions. Make sure you're open with your communication, you know? And this will make it a lot easier for the children to express some of these distressing feelings. You know, children are used to expressing themselves through stories, games, artwork, their creativity. You want to encourage this self-expression. And through this, you want to see how they're doing. Get them to do some artwork, get them to do some coloring or some drawing, or get them involved in some activities that could give you some visuals on how they may be coping. Get them to do some minds-on activities. And what children are so precious, however, we have to learn how to work with them. Usually we want the professionals to come in, but there are certain things you can do. And some of the things you do are, You allow the children, no matter how young they are, to attend the funeral if they want to. You know, if they want to. Keywords, if they want to. People say, oh no, if they want to. You know, you can convey your spiritual values about life or death with your child. If you're that religious person, you could do that. You can meet regularly as a family member to find out how everyone is coping. This is things you can do. And you help that child find ways to symbolize and memorialize that person that they lost in some sort of way. Find it, whether they make something for them or they get pictures of them so that they can look at and just have a keepsake with them, and keep the child's daily routines as normal as possible. Try to keep it as normal as possible. Don't try to change up too much for them. Make sure that they have an established routine, something that you could closely monitor and make sure that they're, where they're supposed to be and that they're functioning at a certain level and that you're monitoring. And you watch the way they're playing with other people. They could be communicating grief in different ways, whether it's aggression, isolation, intimidation, right? These are things you want to do when it comes to children. Those are the things that will benefit the situation. Things that won't benefit is trying to force children to publicly mourn if they don't want to, trying to pull them out. Well, how do you feel? Well, what's going on with you right now? And what do you think someone would say if they were here? Like, trying to force children to publicly mourn if they don't want to can be disastrous. You don't want to do that at all. You don't want to give a false or confusing message. Like, grandpa is sleeping now when he passed away. People do that a lot. They don't, grandpa sleep. That doesn't make sense to the kids. Oh, but parents think, oh, that's going to keep them. No, no. Don't start giving false or confusing messages. You might have to tell them grandpa's gone. He's passed away, and then work through that. And then talk to them, It's going to be a hard thing to do, but try to keep it as real as you can. Telling a child to stop crying is not good at all. Because a lot of times we tell children to stop crying because we're upset, you know, or you're putting that pressure on them to say stop crying because others might get upset, so don't cry. You're trying to control their emotion. No, you have to let them be open and free to express themselves. If they want to cry, let them cry. It's time. Children, adults, let them cry. Crying can be such a release of stress and hurt and pain. Crying. Sleep is good too. Getting some sleep after that cry. It's so therapeutic. And many of us try to hold back our tears. We try desperately to hold back our tears in front of those children. We don't want to cry in front of those children. Well, no, in actuality, you do want to cry if you need to cry in front of your children. It actually allows your children to understand and to get the message that it's okay for them to express their feelings too. You're holding it in, they're holding it, and it's not good. If you have feelings, let it out. And many of you make the very common mistake of when it comes to children, you try to make your children your personal confidant. So you start talking to them about everything. And you don't separate the two. You kind of got this thing going on where they're so connected with you, you feel that they're like your best friends. So you rely on them like another adult, which is not acceptable. When it comes to that, you do not want to turn your child into your personal confidant. Rely on other people, groups, professionals instead. Don't try and turn the kids into adults. It's not fair, it's not necessary, and it will never work. It actually backfires on you. And there's a level of understanding that you must have, that your children are very sensitive and they're still growing. And there's certain things they should not be hearing that they won't really understand, especially your reactions. Because if you are dealing with a child who's going through that, there's going to be a lot of emotions going on. So they don't want to grow up too quick and misplace this emotions, because a lot of things will be said during these times of grief. I find that one thing that we probably don't really talk about as much as we probably should is the loss of our pets. It's so devastating, the impact on our lives when you've had a pet that you've loved dearly and it dies, it passes away. How do you cope with that? We don't even talk about it. And why does that hurt so much? Because we share this intense love and bond with our animals. They're our companions. It's not just dogs or cats. These are actually family members to us. They bring us love and joy and fun to our lives. They are part of our day. They actually make up part of our structure. They keep us active and social. They provide a sense of purpose for many of us. So when they pass on, you could be consumed with such grief and loss. This often feels overwhelming, and it can trigger all sorts of painful, difficult emotions. And many people don't understand how people relationships with their pets can impact them. You know, you should never feel guilty or ashamed about grieving for an animal. Some people say, "Oh, it's just an animal." No, you can't disrespect people like that. You can't disregard their animals. No, to them, they've actually shared a part of their life with them, and it means something. So you cannot dismiss this at all. But we do have to understand that we may respond differently to our pets than we do to another human being. However, it varies from person to person. It depends on the significance that pet played in your life. The more significant your pet was to you, the more intense the emotional pain you'll feel. The role that the animal played in your life has a major impact. If it was, like, say, not just a friend or a companion in the house, what if it was a service animal? Service animal, someone for therapy, a working dog, it could be for the blind, like someone you really depended on that was just like a coworker. It's just or you lose your independence because of that animal that's gone. So you not just lose your emotional support. You've lived with this pet, and it could have been your only companion. You could have been a single person, and that was what your whole life was around your pet. And it's true, and people are serious about these things. And it's what makes life so hard is when they lose their pet. And having a great pet, someone in your life, as a companion, makes life easy. They even say in the research that having pets reduces a lot of stress in your life. Right? Owning pets? No, it's not for everyone. But you can say that they are an integral part of society. And when you lose them, you will deal with some emotions, some heavy grieving. It's an individual experience. And it's in stages. And we talked about the stages of grieving. And if you think about it, as we said before, it's a process that's gradual. It can't be forced or hurried. You're going to go through those feelings of being sad or shocked and lonely, especially in regards to a loved pet that you've had. You can't try to ignore the pain. You can't. It's not just a pet. It's a loved one. It's a companion. Someone that's been there for you. It's an animal that you've showed love to and care to. You've taken care of. You've fed. You've cleaned up after. It's just a part of you. So you can't try to ignore your pain or keep it from surfacing. It will only make it worse, or it would make it run on longer. So you have to learn how to cope. Don't let anyone tell you how you feel when you have a pet. It's your relationship. It's individual to that pet. Oh, there's all kinds of pets out there. No, don't listen to that. When it's time to move on, you will move on, however it takes. But don't let people tell you how to go about dealing with your grief. And it's okay for you to, if you have lost a pet, for you to reach out to other pet owners, you know, through social media. There's even pet loss hotlines, pet support groups, resources for pet owners who have lost. If you have friends or family members who also are sympathetic about pets, those are great resources for you to have. They're going to understand what you're going through, you know? And I don't see this that often, but there are people who go through some rituals when they want to encourage the healing process. They believe that rituals can help healing. Some have a funeral for their pets and openly express their emotions. Some people may consider that weird, but it's not really. This is how deep it is. It's a love for the pets. People ignore many of these healing processes that need to be done, and they think it's inappropriate to hold a funeral for a pet. But it's not what is in their best interest, it's in your best interest. So if you have a pet or a friend, recommend it. Say, listen, you might have to go through it. Set up something. See if there's organizations out there that help them go through that. Maybe it could just help them heal or work through it. Make times a little easier. Try to create a legacy. Prepare a memorial. Planting a tree in memory of the pet. Photo stories, scrapbooks. Anything that's going to get these memories going on this companion that you have. Remembering the good times, bad. You might have videos. Like, show some friends the videos, the relationship that you have. These things are going to help you work through it, or your friends work through it, right? You just got to make sure you're looking after yourself and they're looking after themselves. The stress of losing a pet can quickly deplete energy, and your emotions, can get drained. So, looking after yourself physically and emotionally through these difficult times takes some work. And it does take some face-to-face communication, not just that over-the-phone social communication, social media. No, some face-to-face is going to help. Just make sure you're eating and getting your sleep. And if you have other pets too, you try to maintain your normal routine. Surviving pets can experience some trauma as well. They've got used to the pet that passed away, so they might be feeling something. So you don't want to kind of ignore them. You want to make sure that you're up on your game and you're doing your regular routines and you're maintaining their daily routines with the pets that you have that are still alive. Make sure you're giving them exercise and play times because they still feel. Pets feel. They know a little loss too. They know when something's not around. You know, and I always say, deal as much as you can with support and family and professionals during these times. You know, Dealing with the loss of a pet, you got to remember these are things that other people might not understand. Because not everybody's into pets. People are cats or dogs. Some people have 2 or 3 dogs. Some people, oh, you had 3 dogs. Oh, you still got 2. Watch that comment. One aspect that can make grieving for the loss of a pet so difficult is that the pet loss is not appreciated by everyone. Some friends and family, they'll dismiss it. They will. They'll say some hurtful comments to you if you're a pet owner and you just lose someone. Like, I don't know why you're carrying on. You could just grab another. You could buy a new one. That's very insensitive and it hurts people and it really gets to them because they are trying to cope with someone that they loved and appreciated and they felt was an integral part of their life, but you're not being respectful to them. So you're not really being that supportive person. And those people who are making those comments aren't really there for them. So you have to make sure that you understand this because they have a pet and they have to appreciate that companionship and show their love and express their love for that pet that just passed. So you don't argue with others about whether the grief is appropriate or not. You have to accept the fact that the best support for your grief may come from some outsider, someone that doesn't know you, someone that may be a pet lover, someone who might understand about pets, someone who might have lost pets. Might not be your inner circle. Might be someone else you have to go out and communicate with to get to understand you. You know, you might have to get into that pet community, and that might be part of the healing process too. Actually, reaching out and understanding that there are support groups, right? So you want to seek out others who have lost their pets, right? That's important. And you know, one of the big things is that seniors as well, they have a big reliance on their pets. And especially as they get older and they have loved ones that's passed on, and what's left is their pets. You know, I had an uncle who him and his wife were married for over 20 years. And when she passed along, they both had a pet. But when she passed along, the pet was there, and he really became close with the pet. And he wasn't so close because that was really her pet, but that he really bonded with the pet when she left because that was like a memory that he has of their relationship. So it's important for even seniors to stay connected with their friends, you know, because pets are really good for seniors. Their social life, walking them, keeping them healthy by walking in parks, spending time with them alone, you know, it's just important because they have to remember, you want to make sure that you understand the relationship between the seniors and the pets because it's not just they're sitting there. They boost their vitality. They help them with their exercise. They help them with stay calm when they get nervous. They can resort to their pets, and those are things that are important to seniors who have pets. They become real companions. You know, and just keep an eye on them though if they're older, because seniors who want to get out there and exercise, they got to make sure they're being appropriate out there. They're not just letting these dogs take them out there. They got to make sure, if you're going to support seniors with their pets, make sure that they're healthy enough to be going on long walks, and how healthy their pets are. And if is it going to impact the health of the senior if they're taking these dogs on such a long walk? Sometimes they just could get out there and need to be walking, and their health could be impacted by that. So you just monitor, especially if they're older adults. Because there's been many a times I've seen people who want to see seniors happy. So what they do is they end up going to try and get them like a little pet. That's not something you want to do. You don't want to get them a pet just for, just to satisfy that initial grieving process. You want to make sure that we take pets very seriously, because people will give them, and next thing you know, parent passes on, and then you know they end up putting them in a shelter or something, which is not really fair. So be mindful when you're trying to help a senior deal with grief and loss of a pet. Of course, we talked about seniors, but we just a little reflection when it comes to talking about pets with children, because children lose their pets too. And we just have to understand that this could be their first experience with death, their pet, right? So we have to teach them how to cope with this. So just make sure that we allow them to see us express ourselves with this loss so that they can express themselves. We want to reassure them that, they're not responsible for the death, involve them in the dying process. If, as I mentioned earlier, and if possible, give the child an opportunity to create a memento, allow them to be involved in the service, and you do not rush out to get a replacement pet, like I just said about seniors, because that's what a lot of parents do. You have to make a conscious decision to understand that this is a process that they need to go through. And it teaches them both the value of life too when you take your time and you're patient with the children. And if you're a pet owner like I am, you have to understand that one of the most difficult decisions is when you might have to put your pet to sleep, right? Euthanasia is a big decision for us pet owners, and usually comes after a diagnosis of terminal illness. And this is when an animal is really suffering badly. So just make sure your choices for your pet should be informed by care and the love you feel for the animal. And these are things that you should consider when you are actually going through this process. Like, what's number one? What's the activity level of this pet? Does a pet enjoy life the way it used to? Does it love activities? Are they active at all? Are they responsive to care and affection? Is the amount of pain and suffering too much for this animal? Are they experiencing pain and suffering which outweigh any pleasure or enjoyment in life that animal could be experiencing? Is it terminal illness or critical injury? Have the physicians stated that this is something that it's terminal, and all that's going to happen is the longer this pet is dealing, they're going to be suffering. So those are decisions you have to make. Is this a enjoyable life for this pet and your family's feelings? Is your family unanimous in the decision? If not, if you feel it's in the best interest of your pet, can you live with that decision? Because it's a major decision that you're going to have to make. And there will be some family members that want to hold on. But are you thinking of the best interest of yourselves, or are you thinking of the best interest of your pets? And you have to have certain expectations when you're understanding that your pet's going to be put to sleep, right? They're going to first induce the pet with an injection, right, of a drug, right? The veterinarian more than likely will administer a tranquilizer just to relax your pet. And then following the injection of the euthanasia drug, your pet will become unconscious. And usually death is quick and painless. You might see a little bit of movement of the legs and some deep breathing several times, but after the drug is given, these are some of the reflexes that you will see. It doesn't mean that your pet is in pain or is suffering. It's just part of that whole process. So you see there's a few steps that are in place that physicians or the veterinarian will administer to put your pet to sleep. And you have to understand this because you want to know if you want your child to be a part of that. And you might not want them with that understanding that it could be traumatizing to the child. Sometimes that's not what you do. You don't do that at all if it's going to be way too much, depending upon the age of your child. There might be something that they don't want to see. And you have to make that decision depending on the age. And I would say at least 10 to 12 years old minimum where they'll understand it. But even then, it's a personal thing. That's a judgment that you make as a parent. Don't try to make your child your best friend, as I said, where you want to include them in everything just because you think, oh, it's such an experience they're going to like. Because you like it. It could be devastating to them, right? Could be their first experience that's traumatizing them. You may be able to express verbally the process to your child and how they go to sleep. However, and just having them there might be a little bit too much for them. So keep this in mind. These are ways that you can help support people through grief and loss. I want to say thank you to all my listeners, and I want you to spread the word and tell some of your friends. Some of the conversations we have apply to real life and the decisions that we're making and the emotions that we go through and our understanding of the world. When we go through it with a better understanding, we bring balance to our life. When we share these expressions and these feelings and experiences, they make us better people when we support each other. And that's what we're really talking about, really supporting each other. So the counselor is saying, thank you to all my listeners. I'm going to speak to you again, and I really appreciate when you tell your friends and discuss some of these podcasts with them, because I think it's important. It's relevant. All right, so take care of yourself.